Hello, this is Jennifer Gitson. I'm a student with Indiana State University in the LVN-BSN Program in NURC 444 Community Health Program. This is a presentation on insomnia, as I believe the community as a whole I think many people suffer from insomnia due to the everyday stress of being an adult. These are the objectives. What is insomnia? What are the symptoms of insomnia? How is insomnia diagnosed? What are the risk factors and causes of insomnia? And how is insomnia treated? So first, what is insomnia? It's a common sleep disorder that people have when they are having trouble falling asleep, staying asleep, or getting good quality sleep. There are two types of insomnia: short-term insomnia and chronic insomnia. Short-term may be caused by stress or changes in your schedule or environment. It can last for a few days or even weeks. Chronic insomnia occurs 3 or more nights a week, lasts more than 3 months, and cannot be fully explained by another health problem. So what do you need to know? Insomnia can affect your memory and concentration. Chronic insomnia raises your risk of high blood pressure, coronary artery disease, diabetes, and cancer. All because you can't sleep. So what are some symptoms of insomnia? You may lie awake staring at the ceiling for a long time before you can fall asleep. This seems to be more common in young adults. Sleep may be possible for only a short amount of time. You may wake up often during the night or be awake for most of the night. This is the most common symptom and affects mostly older adults. Waking up 2 in the morning and not being able to go back to sleep. I know some people that I work with, they wake up at 3 o'clock and not able to go back to sleep. Also, some symptoms: poor quality sleep may lead you to wake up feeling unrested and you may feel sleepy during the day. You may also have trouble focusing on your daily tasks because you feel anxious, sad, depressed, or easily annoyed because you weren't able to sleep all night. So how do they diagnose insomnia? They usually request a sleep diary of at least 1 to 2 weeks. This will be able to help the healthcare provider make a diagnosis for you. You should record any symptoms of insomnia you might be experiencing, and these are good things to add to your diary. How often you've been having trouble sleeping and how long. What time you go to bed and what time you wake up, and what days you're off of work. How long it takes you to fall asleep at night. How refreshed you feel when you wake up in the morning, or how unrested you feel. Whether you use electronic devices before you go to bed. And do you snore loudly or wake up gasping for air? So what kind of diagnostic tests do they do? They do a sleep study, which looks for other sleep problems such as circadian rhythm disorders, sleep apnea, or narcolepsy. An actigraphy looks at your periods of rest and activity and measures how well you sleep at night. This requires you to wear a small cap on your head, on your wrist, for 3 to 14 days. I was thinking of a EEG. Blood test, which can check for your thyroid, which can really affect your sleep. Thyroid can affect so much different stuff. So what are risk factors of insomnia? I found this little picture here. Switching time zones, blue light, like looking at your phone, stress, alcohol, smoking, caffeine, heavy food, some medicines, environmental factors, and uncomfortable pillow. So like this over here says age, family history or genetics, job or sleeping environment. People who do shift work or night work, they have trouble going to sleep, especially night shift people. Noises at night. If it's really hot in your room. Lifestyle habits. Changing your normal routine. Being interrupted when you're sleeping at night. Taking naps during the day. Getting no physical activity. Using caffeine, nicotine, alcohol, drugs. Watching TV before bed. Stress. Stress is a big one. Sometimes I can't sleep because of school. So, fun fact, insomnia is more common in women than in men. This is probably because of hormones. So, what treatment do they use for insomnia? Providers will encourage you to make your bedroom more sleep-friendly. Try to sleep in a cool, dark, quiet place. Don't use your electronic devices. Go to sleep and wake up at the same time every day, even on the weekends. Get regular physical activity during the day, 5 to 6 hours before going to bed. Don't want to go run a mile and then go to bed. You might have trouble sleeping because you need to wind down. Avoid naps. Eat meals on a regular schedule. Limit how much you drink before bed so you're not getting up to go to the bathroom at night. Learn new ways to manage stress and avoid over-the-counter medications or prescription meds that can interrupt your sleeping. They also have this cool thing called cognitive behavior therapy. It's a 6 to 8 week treatment plan that helps you learn how to fall asleep faster and stay asleep longer. Usually recommended as the first line of treatment. Last but not least, what type of medications do they use to treat insomnia? Benzodiazepines like Ambien, Lunesta, Sonata, melatonin, which is a good over-the-counter drug, and then orexin receptor antagonist, like Belosmara and Dayvigo. You should not use these medications if you have narcolepsy. So this is my reference. I just used one reference, which is from the U.S. Department of Health and Human Services. So it's reputable information. Please access my pre-test, post-test, and my flyer so you can see if you learned anything and share it with your friends. Thank you for watching my PowerPoint on insomnia, which is community health problem because it affects lots of the population as we live a very fast life in the United States.